Again, a very good day to my dear undergraduate students. This is an extremely short video which will be covering a spotter on chronic lymphocytic leukemia. This can be given to us as a slide or as a chart. Definitely questions can be asked in hematology viva, and this is a university question by itself. Even otherwise, I always tell the students, when you compare and write the differences, you score an additional point in it. These are the references to which you people should go. The chronic lymphocytic leukemia. This will be a picture that will be focused either in the slide or kept as a chart. Now, what we are seeing in this? Generally, at one look, concentrate only on the WBCs, forget the RBCs in the background. They all appear small and uniform, resembling the mature lymphocytes. So this is the arrow over here. Some of the cells, however, are slightly larger. They have a more abundant cytoplasm. Not very much, but still they are different from this. They are the pro-lymphocytes. The percentage will be very minimal, less than 5%. And still others, I find that they are somewhat smashed or smeared, and they are called the basket cells. Smudged cells or the basket cells. The blank arrow. These three things we people should be able to mention. So the slide shows an increase in the small round cells about the size of RBCs having a scanty cytoplasm with dark hyperchromatic nuclei. A few cells, the pro-lymphocytes, have an oval appearance and slightly more abundant cytoplasm. A good number of smudged cells are also seen. This is supposed to be a hallmark of a chronic lymphocytic leukemia, very easy for you people to identify. And history-wise, chronic, whenever this word comes, the patient will be of an older age. You will not be getting a CLL in a young child. So that will be important. Patient usually is beyond 50 years of age. So look at this. Explain it once again. Multiple small lymphocytes. There are a few pro-lymphocytes that are seen and a good number of smudged or basket cells. Platelets are decreased and RBCs are almost normal. Platelets will be decreased in all kinds of leukemias except the chronic myeloid leukemia. And compare it with this. These are supposed to be children from a school. And what is particular about it is the uniform. Maybe someday you people also will be wearing a uniform. So, since the cells here are uniform, this particular pattern has been described as a schoolgirl pattern. For heaven's sake, in the exam, straight away do not answer only schoolgirl pattern. You should be able to explain the smear. The WBCs are increased. They are composed predominantly of lymphocytes. The cells are of uniform size. They are small and having scanty cytoplasm resembling the mature lymphocyte. A few cells are larger, the pro-lymphocyte, and a good number of smudged or basket cells are seen. RBCs are normocytic, normochromic, and the platelets are decreased in number. Therefore, my diagnosis is chronic lymphocytic leukemia. That is the way you people should answer. In addition, this pattern can be described as a schoolgirl pattern. Do not put the donkey first. Schoolgirl pattern of uniform cells. If you write this alone, that's what I tell my students. If you write the schoolgirl pattern alone, you will get 0 marks. The examiner will laugh at you. But this is an important clue that has been with us for decades and decades. So what are the important points? Older age group. Anemia. Patient may be having a mild to moderate anemia. Platelets are decreased. And the total WBC count can be more than 1 lakh per cubic millimeter. So this will be the feature. Maybe there can be mild splenomegaly, etc. But don't bother about all that. If you are given a chart, you should be able to diagnose it by means of the uniform cells and the smudge cells. All the other things you should be able to make up, because this is a theory question. This is a question in the Viva. This is definitely a slide for you in the exam, and it will be kept as a chart also. In addition, always when you do a differential count in a peripheral smear, the examiner has got a right to ask you. So do not prevent or evade anything, and don't treat 2 points alone. That will land us in trouble. So these are the things that you people should be prepared for. Questions during practicals also. Thank you.